Correlation of serum vitamin D levels with tear film parameters in dry eye disease. Dry eye syndrome is a multifactorial condition and that results in symptoms of discomfort, visual disturbance and tear film instability. Recent studies have shown that dry eye is an
Anjali,
inflammatory
you first
disease.
introduce yourself. Where are you from and what are you doing right now?
Good morning everyone, I'm Dr. Anjali Singh. I'm from SSMC College, Riva. And vitamin D deficiency that is related to various other medical diseases may also cause dry eye, as studies have reported dry eye syndrome to be a localized autoimmune disease. My aims and objectives is to study the correlation between serum vitamin D level and tear film parameters for stability and secretion. My study center was my college. Duration of study was between March 23 to February 24. It is a case control study and the sample size is 40 cases and 40 controls. Inclusion criteria for my cases were all patients with dry eye syndrome, and exclusion criteria for my cases were regular contact lens users with history of smoking, current or recent drug use affecting the lacrimal function, active ocular infection, scarring or previous eye surgery, and the inclusion criteria for controls were healthy individuals with no evidence of dry eye. The comprehensive ophthalmic examination included visual acuity, AS examination, IOP measurement and fundus. Dry eye assessment included OSDI, Schirmer test and TFBUT. Serum vitamin D levels were estimated for dry eye patients as well as controls using immunoassay method. Correlation of mean serum vitamin D levels with mean values of tear film parameters were analyzed. The results showed the mean age of case group being around 52.32 years and mean age of control group were around 51 years for the cases. The male to female ratio in the case group were 1:1.46 and for control group were 1:1.32. The results for mean OSDI score for cases were around 40. For Schirmer test was around 9.82 and TFBUT was around 6.38. The most of the cases were fell under the category of vitamin D deficiency, that is 67.5%, and the results were found to be significantly lower among cases vitamin D deficiency. This is the correlation graph between the OSDI score, Schirmer test and the TFBUT, in which the OSDI score showed negative correlation and Schirmer test and TFBUT showed positive correlation. Discussing the study on comparing the mean levels of serum vitamin D between cases and controls, we found that DAS patient had a significantly lower vitamin D level compared to the healthy control group, and stratifying the dry eye patients according to their vitamin D level, we found that most of them were vitamin D deficiency. Almost all studies comparing serum vitamin D levels between dry eye patients with healthy controls found a statistically significant lower vitamin D level in dry eye, and studies that evaluated serum vitamin D level in dry eye patients only also reported DS patients to be having mean vitamin D levels in either the deficient grade or insufficient grade. We found a significant negative correlation between OSDI score and serum vitamin D level of patients, and this is in accordance with the studies by Meng FY et al. And Shah P et al. However, Lee JH et al. And Jin KW et al. Found no correlation between OSDI and serum vitamin D level. Analyzing the correlation between serum vitamin D and Schirmer test value as well as TFBUT, we found a significant correlation which was positive, and similar observations were made by Jin KW. Shah P et al. Also found a positive correlation with Schirmer value, but unlike our study, they did not find any correlation with TFBUT. So, concluding the study, it confirms that serum vitamin D levels are deficient in patients of dry eye, and furthermore, a significant association exists between serum vitamin D levels and various parameters of dry eye like OSDI, Schirmer and TFBUT. So the take-home message is all patients of dry eye disease should undergo at least a serum vitamin D level assessment, and vitamin D supplementation can be given as a potential therapeutic strategy for refractory patients. References, thank you.
Thank you, Dr. Anjali. Vitamin D supplementation, you gave How many dose in which form?
Actually, sir, in my study, we did not give any therapeutic vitamin D. We just studied the serum vitamin D level.
How does the vitamin D deficiency affects dry eye and which layer is affected? Aqueous layer, mucin layer or lipid layer? Which layer is mostly affected by the deficiency of vitamin D?
Sir, we just tested the dry eye
As you told that
parameters.
TFBUT and the Sharma are directly related to the vitamin D deficiency, which layer is importantly involved in vitamin D deficiency?
Mostly, sir, in our study, we didn't actually categorize between the aqueous or mucin layer.
No, but with the references you must have read that vitamin D, what is the mechanism? How does it cause dry eye?
Vitamin D actually,
Where is the defect? Which layer?
it's in the mucin layer.
It is the aqueous layer,
Aqueous layer.
right? Then suppose we correct the vitamin D deficiency, is it going to affect the dry eye or going to improve the dry eye?
So the studies have not confirmed that vitamin D is actually related, because in many studies they have said that vitamin D is not vitamin D supplementation is not improving.
It's no definitive treatment, it's an arbitrary treatment because you have categorically said in all cases of dry eye, suppose there is a disease of Mewman gland, is it going to help in Mewman gland deficiency, dysfunction diseases?
Sir,
Definitely not.
yes, sir.
It is one of the factors. Thank you.
Yes, sir. Thank you, sir.